helping you to weather good and bad economies without putting retirement on hold. This is the Tumolo Financial Podcast with Ken and Nick Tumolo. Ken and his son Nick know that creating a comprehensive financial plan can align your hard-earned life savings with your retirement goals. Consider them your retirement architects. Now, the Tumolo Financial Podcast with Ken and Nick Tumolo.
Nick is here, and his wife, Alyssa, is joining us for this part of the conversation because it's that time of year, Medicare, sign up, or I guess, what's the proper terminology, Alyssa? Help me understand it. You can either choose to sign up if you're new to Medicare, or is it something every year where we need to renew our benefits, look at our benefits? Do you have to re-sign up every year for Medicare?
Yeah, so it's the technical term is the annual enrollment period. It's more for those who have been on Medicare that maybe want to make changes to their coverage, switch to a different plan, reevaluate.
Okay. And also, what's your title? How is it that you know so much about Medicare? Talk about your background a little bit.
So I'm a licensed independent broker, and I do specialize in Medicare. That's kind of my jam.
Okay.
I enjoy it, and so
Glad to hear that somebody does.
Yes, I represent multiple insurance companies and just try to find the best fit for our clients.
Okay. Well, we're going to dive into some of the things that listeners need to know as far as, again, the time of year and what they need to be thinking about, answering some questions that they might have in regards to Medicare benefits and action items this time of year. But first, let's talk about, and it all plays together, Medicare, retirement planning, and the age of how we do things and how we approach this overall retirement planning process. Because this was actually the statistics, Nick, that I saw in this article. It shook me a little bit. The lack of preparation, lack of awareness that so many of us have. If you're listening to us and you're in your late 50s, early 60s, you're thinking to yourself, well, I'm going to work another 5 years or I'm going to work another 10 years before I retire. There was a survey done by Transamerica that found 60% of people, 60% of us actually don't make it to that planned retirement date /age. And it's mostly due to, one, a loss of employment or health issues, not just for themselves that have them retiring early, but a health issue with their spouse or with their parent. Here's the other sobering statistic, and this is what makes me want to, lean into this conversation that we're having here on Tumolo Financial Radio. Only 20% of respondents to this survey said that they retired because they had their finances in place. And that makes me sad because I feel like, again, so many of us just don't know how to financially plan for retirement. So let's talk about the reasons, the urgency, taking the time now, the action items now to sit down, plan out the details of our plan, and pointing out the good reason why it is now. Now is the time. We always say that. The time is now. Let's get a jump on things, right?
Right. And I'm shocked by that number, 60%.
Yeah.
I was not expecting that.
Right.
And it makes me actually think, going back to COVID, I remember dealing with a few plans and saying, okay, if they did lose their job because they were worried there was cuts happening at their job, would their plan work? Because we had to improvise on it. Even I had someone come in, actually, she's been working with me for about a year now, and she's had some issues health-wise, and she's always wanted to go to 62 years old.
Okay.
And she was worried about her health. She's 59 right now. And we built out a plan if she needed to retire today, would it work? And it actually did it for her. So she's in a good position. But that's not the case for many people when you have to retire early due to health issues and other things like that. So sometimes it is unfortunately cutting back. So you want to have a plan in place. Like you said, I think it was 20% of people don't have a plan.
Only 20% of people retire because they have the financial plan in place.
Yeah, so that's why we really preach having that plan set in place on this radio show. I wish more advisors would do the same for their clients too, looking at those things, making sure that they'll be okay during those good or bad times. Mm-hmm. And that's why, like, for that person, like I said, that if she had to retire because of medical, she was able to, but we have that plan set in place for her in case that did happen. And she's dealing with other things now too with, she works for a job that done cuts in the past too. So there's a few things for her. Her job's pretty stressful, not knowing when the next day is going to come. I just got news from her that her health is finally in a good spot, and she doesn't think she has to medically retire at all.
That's great.
So great news for her, which I was happy about.
Yeah.
But those cuts are still happening at her job. So now it's another thing. So I'm glad that we have the plan set in place. So if something does happen, she's ready to go no matter what. Okay. And like I said, that's why you want that plan set in place, just to make sure that you're okay. Because like I said, even the medical, but we're talking about even COVID in the beginning of 2020, we had a lot of people call us back up, even our clients and people that we don't work with, and be like, I'm not sure if I'm going to have my job and this and that. We had to improvise and show them the plan, show them what it looks like. Do they have to go back to work when some jobs also open up? Because we didn't know when jobs are going to go open back up. Do they have to go back part-time, full-time? So yeah, we had to build out a few plans. That's why even when we work with people, we do 6-month reviews with our clients, just because we know things change. Whether you do want to work longer or you have these unforeseen circumstances happen, you want to be ready for those times. And that's where that Tumolo Financial Retirement Checkup comes in. We do a complimentary. Our phone number is 860-854-3434, or you go to our website at tfcheckup.com. But like I always say, when you're building out that plan, whether you want to work longer or retire early and hit your goals and dreams, you just want to have that plan set in place. So if you're going to Italy, you want to work longer to 70, 75, which Alyssa will talk about in a second because Medicare kind of factors into that piece. You want to look at everything possible to give your best advantage moving forward.
Right. Alyssa, more information out of this study. It talks about how the median retirement age is actually 62, which is 3 years younger than the traditional retirement age, 65. 65 being such a key age for us because that's when Medicare kicks in. That's when we are allowed to file for it. So let's talk about age limitations in this space and what we need to know and what can be done in regards to Medicare.
Yeah, it's a big factor. I think a lot of people do try to hold out till 65 because they are concerned about healthcare. And I know, Nick, you have a lot of people that maybe want to retire early. And we then on the flip side with Access Health, we try to, figure out how to get them healthcare to bridge the gap until they get to 65. But for those who are 65 and maybe are still working or thinking about retiring, I have a lot of people come in and they're still working and they're like, I'm getting all this stuff from Medicare because I'm turning 65. And what do I do? Do I have to do anything? Because I still want to work. But it's important to kind of know where to go. So original Medicare is parts A and B. So part A is your hospital insurance. Part B is your medical insurance. Part A, it is usually has no premium if you've worked 10 years or more in the US and have been contributing into that system. So a lot of people will say, okay, well, I'm still working. I'm still on my employer coverage. So why don't I just go on part A? That way I have that, extra hospital insurance. One thing to know is that you cannot contribute to an HSA if you are on Medicare. So if you contribute to an HSA, you want to keep doing that with your employer, then I usually tell people don't sign up for part A or B. Just avoid that. You don't want a problem with the IRS. Just, follow the rules with that. Just defer Medicare. So you don't have to do anything if you're still on your employer coverage. Part B, your medical. So that is part B and D are where you can incur some penalties. So that's where a lot of people get concerned too, especially if they're still working and gonna, defer Medicare. They get nervous. Am I going to get a penalty later on? Part B, if you have proof that you have creditable coverage. So creditable coverage for part B and D, that's like the big word for people. And so you want just something from your employer, your HR, your benefits department saying that you have that creditable coverage. They cover as much as Medicare would or more. And that way, when you do go to sign up for Part B, that you just submit that paperwork in and they will not penalize you for deferring your Part B when you turn 65. So that's important. If you do not have creditable coverage, then you want to make sure you sign up for Part B right when you're eligible, because you don't want those penalties. They're lifetime and they can really increase your premiums and you can't get away from them. So
got it.
That's one thing.
Okay.
If you are 65 and continuing to work. Now, we were talking about being 65 and maybe retiring. So yeah, I mean, what happens is you don't have to wait for the annual enrollment period to retire. If you're retiring and you have group health insurance, you get a special election period that opens up for you to sign up for Medicare. So I know a lot of people think they have to do it. I had someone come in the other day and she said, I'm retiring in February, so should I sign up now in this window of October 15th to December 7th? Mm-hmm. And she was kind of worried about it and feeling rushed. And I said, no, you don't have to. You'll get a special election period because you're losing your employer coverage when you retire. So that's not something you have to do right now. If that's something you're concerned about, I would just say give it some time. Things are kind of taking a little bit longer in the Social Security office now. So usually a month or two would be good, because your first step is you have to go down to Social Security or call them, make an appointment, and you have to sign up for Part A and B. So Part B if you want it. So that can take some time. So give yourself enough time. And then if you want to do additional coverage, like an Advantage plan or a supplement plan, prescription drug coverage, I would say 2 to 3 months before you need the coverage, 3 months on the safe end, because it takes a little time.
Takes a little time, takes a little patience, takes a little education and awareness, all of the things that you were just saying just in the last few minutes. I know that if you're listening to us on the radio right now and you are close to the time for filing for Medicare, or maybe you're new to Medicare, you've just been on it and you're still confused by it all. Listen, at Tumolo Financial, we're here to help you unpack these things and have clear understanding as to what your options are and what benefit options you have. So if you have questions about this, let's get some time on the calendar for you to meet with Nick and Alyssa and the entire team at Tumolo Financial. That number is 860-854-3434. You can also go to tfcheckup.com and click on the Contact Us button. We've opened up 5 spots on the calendar. If you are within 5 to 10 years of retirement, if you've saved $500,000 or more, this is where you're really going to see the benefits of the kind of planning they do at Tumolo Financial really kick in, and want to show you what we can do for you as well. Again, it's 860-854-3434. Give us a call for your Tumolo Financial retirement checkup, one that includes the Medicare checkup of your plan and what your benefit options are. 860-854-3434. Let's talk a little bit further about Medicare, because as I was saying at the beginning of our conversation, it's that time of year. If you're using Medicare, the window to make changes to your plan, it begins October 15th. And then Alyssa, help me. When does that go to? It goes to December something. Isn't that correct?
December 7th.
Okay.
Yep.
All right. So you may be receiving something in the mail labeled ANOC. That stands for Annual Notice of Change. And this tells you what the new costs will be for your Part C Advantage and D prescriptions in 2026. And next year may bring some significant price hikes in premiums and deductibles. So if that's the case, what are options? What can we do?
Yeah, so it's going to be an interesting season just from what I've been seeing.
Okay.
So last year, with all the Inflation Reduction Act changes that kind of came into play with Part D, insurance companies are being squeezed financially. So only 48% of people read their annual notice of change, according to a study. Read it because things are going to change and, a lot of benefits are being reduced. Premiums are expected to rise by 5% on average. So it's just, things are going up and insurance companies are trying to make up that loss that they had. So If you're not familiar, last year we got rid of the donut hole or coverage gap phase of prescription drug coverage, and they put into place a $2,000 cap on prescription drugs for out-of-pocket costs. This year it is going up for 2026 to $2,100 is the cap. But so insurance companies then had a lot more of the onus on them to kind of chip in for those drug costs. So they're feeling it, I think, which isn't great for you all. Read those ANOCs and then go over it with someone who can explain it to you. And so you know what the changes are going into next year. So we might be seeing our prior authorizations for certain services. They might be getting more restrictive. So if that's something you're concerned about, know what the rules are with your plan. And if they're getting more restrictive and that's a concern for you, maybe look at what some of the other companies out there are offering. I'm seeing a lot of PPO plans being cut and going to HMOs. So PPOs, what they do is they give you the option to go out of network. So you have a network of doctors. You can go to an out of network doctor for service. You just might pay more in your copays and your cost sharing. An HMO plan means you cannot go out of network unless it's an emergency. So the trend this year is a lot of insurance companies are cutting their PPOs and going to HMO plans. I know I have a lot of people that like the flexibility of having the option to go out of network, or they travel and, it's nice that if they have a company that has a national network that they can go see someone else. So that's definitely going to be a conversation with, my clients this year. A lot of the Medicare Advantage plans are dropping some of their dental benefits. Maybe they had a certain maximum on comprehensive dental services, and now they're just going to preventative, like cleanings, exams, x-rays. That's all they're covering now. A lot of them used to have an over-the-counter credit, and that's going away. So just to give you an idea, United Healthcare, which is the largest provider for Medicare Advantage plans, is expected to drop plans for 600,000 people this year. So if your plan is being dropped, that will be in that annual notice of change. And either what they do is they either then kind of migrate you to a different plan automatically if you don't do anything, or they're just dropping you and you need to find a new plan. So those are things to be aware of. With my clients, I look at everyone who is, who works with me, and I look at what plans they're on right now. And I do an evaluation of their prescriptions, their doctors, to see, if there's maybe some other options out there for them. And then obviously letting them know what the changes are for next year, and kind of seeing where their head's at, because things change too for you, right? So every year benefits change, doctors' networks change on the insurance company's side, but health concerns might come up for you. You might be traveling more, you might be moving. So it's important to kind of take those factors into consideration every year. On the Part D prescription drug end, the maximum deductible is going up to $615 for 2026, so a slight increase. But if you're not used to having a deductible on your plan, a lot of plans are adding in deductibles. So you might have some higher prescription costs up front in the beginning of the year until you satisfy that deductible. So these are all things we want to look at. Another thing that's coming into play this year is there are 10 prescriptions that all Part D plans must cover. So if you're on one of those, that's something, to look into and know about. And then another thing that a lot of people don't realize when they're on a Part D plan or a Medicare Advantage plan with prescription drug coverage is that there's preferred pharmacies. So maybe you just love going to Pharmacy A. And you might be paying more because you're going to Pharmacy A because they're not a preferred pharmacy with your plan than if you go to Pharmacy B, which is like a mile down the road. So, just knowing what those preferred pharmacies are on the plan is important too, because it can save you a little money, especially if you have that deductible or higher cost shares this year. Saving a little bit here and there might be beneficial for you. I had someone come in the other day, and she is on a very expensive injection for, an autoimmune disease. And there was only one company that covered on their plan's formulary, that drug. So for her, it's important to know that, okay, that insurance company really is your only option for that drug because it is so expensive. It really is best for her to go on that plan. And what I do is I showed her the side-by-side costs, and she was like, yeah, I'm definitely going on that plan because it covers this prescription. But again, those things can change every year. So it's just knowing what the formularies look like every year, sitting down with someone who can kind of just break it down for you, break down the changes, and not also bog you down with so much information so that you can make a choice that, is suitable for you.
Yeah. And I was just going to say too, if you want to talk to Lissa, talk about plan A through, I think it's N now.
Right.
And see, I don't know too much about Medicare. So I'm probably talking out of my range, but Medicare Advantage supplement plans. You want to talk to Lissa about that. Income levels, talk to me. Part B and D, the more income you have, it costs more to have Part B and D. So you can give us a call. We do this complimentary. Our phone number is 860-854-3434. Or you can go to our website at tfcheckup.com.
Investment advice offered through Tumolo Wealth Management, a Connecticut-registered investment advisor. Content contained herein should not be construed as an offer or solicitation for investment advice or for the purchase or sale of any security, insurance, or other investment product. Please consult with a qualified financial, tax, accounting, or legal professional before implementing any ideas or strategies discussed here.